Starting with my biography, my name is Prudence Masanga and I'm a young scientist from the Manyara Institute of Science and Technology, and currently I'm doing my master's in biomedical science with collaboration with Kubangoto Hospital. My area of research is on One Health discipline with the focus of extrapulmonary tuberculosis infections associated with zoonotic transmissions. My background, I have done Bachelor of Science in Microbiology from the University of Dar es Salaam. And currently I'm working at the University of Dar es Salaam at the Microbiology and Immunology Department. So going straight to my area of study, which is tuberculosis infection, TB. TB has been one of the infectious diseases which has been a burden for a long time, not only to Tanzanian country, but also to the whole world. And currently WHO is changing the story by talking ending of tuberculosis infection by 2035. But this might be a dream to Tanzania if we are having the zoonotic transmission of TB. Because in Tanzania we have been mainly dealing with TB, which is transmitted between human beings and human beings, which is mainly caused by Mycobacterium tuberculosis. So checking our diagnosis and our treatments, they are focusing on Mycobacterium tuberculosis. But talking of TB, it can be caused by other Mycobacterium species like Mycobacterium bovis, Mycobacterium oryz, Mycobacterium papyrus, and Mycobacterium africanum. And these are transmitted from animals to human beings. And looking at the cross-linkage we are having in Tanzania with animals, cattle, it's very important to consider this. And our focus came after the alarming situation which we have been seeing in pastoral societies. In all the years, we've been having many cases of pulmonary TB. Like you can see on the picture at the top, that is pulmonary TB, which affects mainly the lungs part, and it's the one which many people are aware of. But also we are having this extrapulmonary infection, which are very rarely to be happening, but currently we have been having the instances which are increasing, especially in the pastoral societies. We have get this information from Kubangoto Hospital, which is dealing with TB patients from the northern part, which they are mainly pastoral societies. So it's very important to go and deal with this zoonotic transmission if we want to reach the target of ending TB by 2035. So going straight to my area. So for the management of this disease and to control this disease, it's very important that we establish the burden and the species diversity of the Mycobacterium tuberculosis. But talking of the management, the zoonotic TB, it has been highly underestimated for many years. We have been just focusing on the transmission between human beings and the human beings, talking of Mycobacterium tuberculosis only. And this have been due to a number of reasons. First of all, we have limited routine surveillance of the disease, but also the diagnostic tests commonly used are the simple ones like skin test, ZN stain, and culture, which we just end up on the culture stage. By using this diagnostic tests, you can't distinguish the Mycobacterium tuberculosis infections and the other species. So you just get that it's just Mycobacterium species, but not knowing who are the true species. And this is very important because, for example, talking of Mycobacterium, the person infected by Mycobacterium tuberculosis and the one who is affected with Mycobacterium bovis, these people, they will come to define their treatment regime. You see, there are some drugs which are the first line in Mycobacterium tuberculosis, and they are resistant to Mycobacterium bovis. So, if you find a person infected by Mycobacterium bovis and you take them straight to paranthite, which is resistant to them. That's these issues will be increasing resistance level in TB in our country. That's why it's very important we go to the lower level of knowing the species diversity of Mycobacterium. So for So on our study, we went further by using the molecular ways to diagnose the patients so that we can get the species which are around our societies and know the burden of TB we are having. So we collected samples from 335 patients. 300 were pulmonary samples and 35 were extrapulmonary samples. So our plan was to get a large number of extrapulmonary samples, but we had a number of time limitation because of the COVID-19 issues. We did our ethical permits were limited. We had a number of limitations, so our interest was to have a big number as possible. We'll check in the future if we can, because we are really interested to get to know the species in these extrapulmonary issues. So we got these samples from the patients who are presumed to be patients. in Manyara region. And the samples were first analyzed by normal routine by Ziedenstein, and then we did the culture in both solid and liquid media, but on the culture procedures we used the liquid midget culture. And for the positive midget samples, they were taken for the PCR for analysis. And on PCR we were doing the matrix real-time PCR, and we had two sets. The first set, it was able to differentiate between the human lineage and the animal lineage, and the second set, it was for those which were animal lineage, so that you can differentiate them to the species level, if it's embodies or MCAPI or MOGs. So on our study, we went So our procedure was first we captured our samples on the midget. After the contamination process, we captured them on the midget, and for the samples which were positive, we took them for confirmation, where we captured them on blood agar, we did ZN staining and the MPT64. So for the samples which were positive in ZN stain and MPT64, these were the Mycobacterium tuberculosis complex species. And for the samples which were growing in breed agar and they were ZN negative and MPT64 negative, these were regarded as non-tuberculosis Mycobacterium, which are also can cause infections but not TB. And for the ones which were ZN positive and they were growing in breed agar, we regarded them as contamination. So we took the Mycobacterium tuberculosis complex straight for the amplification in PCR. On the PCR, as I explained before, that we had two sets. We had the first set, which we had the premise of IE 1081, Mycobacterium animal, MTCN, and MTC human. This one was to identify if it's animal lineage or human lineage. And so if it was for the ones which we have got for the human lineage, we are planning to take them for the whole genome sequencing. And the ones which are, if they could have been found as animal lineage, we could have run the PCR again to check with the MBOVs, MCAPI or MOGs. And after that, after identification, we could have also taken them for the whole genome sequencing. And for the as per my study current, I've just ended on PCR. So from the meningitis culture, we get total 100 samples which are positive. Among the 100, after the confirmation, 18 were confirmed positive MTBC, 6 were confirmed non-tuberculosis Mycobacterium, and 76 were contamination. Then the 18 samples which were confirmed positive MTBC, they were taken for PCR analysis determines whether they are human or animal lineage. And when we did the PCR, we found all the 18 positive culture isolates were found to be human lineage. So they were all positive on PCR and they were human lineage. The study intends to further proceed with the whole genome sequencing for these human lineage samples. And as I explained before, our hypothesis was mainly on the extrapulmonary samples, and I think we didn't get the animal lineages because we didn't get enough samples on the extrapulmonary samples. So this is the species we got TBC and TM and the father. The 5.1% prevalence from culture results is a good indicator, as it shows the burden keeps on declining and show that all the works which are being done and campaigns are working. Moreover, identification of this species will be useful in the policy formulation of the TB treatment schemes toward combating drug-resistant TB. As for now, we are just using the one scheme which is based on the Mycobacteriumtuberculorsis, which is a human-to-human transmission, and even the diagnosis are based on that. And moreover, to help in management and control and surveillance of the disease, which will foster the achievement of eradication of TB by 2035, according to the WHO target. So I think this study is very important, and we are looking to carry it further. My master's was limited in time, but we are looking on to carry it further and do the sequencing even after I accomplish my master's. We are looking to do further studies to get all the species which are in our societies and submit these details for policy formulations. Thank you. And thank you. I would like to give a special thank to you all who are listening, but also to my founder, African Development Bank, AfDB, and Nelson Mandela.